Hey everybody, it's Jessica DeMassa with What's the Future Health. We are talking to the who's who of health tech and healthcare innovation. And joining us today, we have the team from Firefly Health, who has just raised a $40 million Series B led by Andreessen, participation from Oak, HCFT, and F Prime. Please welcome to the show Fay Rotenberg, the president and CEO of Firefly, and Jonathan Bush, its executive chairman. Friends, congratulations on the fundraise.
Thanks, Jessica.
Thanks, Jessica.
This is exciting news. We were wondering what was going on with Firefly. It's been a while. So Fay, catch us up on this fundraise first and foremost, which I understand you closed from a hospital bed while also 8 months pregnant. So, give us the details behind this. And Andreessen, phenomenal investor, right? So talk to us about the fundraise.
Yeah, thrilled to have them on board. Julie Yu is the general partner that will be joining our board, and have known Julie for years, just in the healthcare ecosystem as an operator during her time at Kaiser, and really respect her as an investor, and excited to have the entire team there. And I think it really is about the team and the platform that they'll bring to bear to this investment. So we raised $40 million. A lot of this is going to fuel our full benefit that we're building out and geographic expansion.
All right, we'll get into that in a second. I want to talk first about this whole virtual primary care space. So can we get a level set for us how this is different from some of the other primary care clinics that are out there that are also raising a lot of money? And we'll get into all of the money that is going just into primary care, period. But before we do, let's talk about that virtual primary care carve out. Tell us what you guys do over there at Firefly.
Because it seems like there's another virtual primary care company that pops up every week, and every week another gets funded. I think the vast majority of virtual primary care companies out there are really just virtualizing and the underlying episodic system. So they're much more about urgent care. And I'd say they're solving for convenience, but not necessarily for value. Firefly started, and its core is still virtual primary care, behavioral health, specialty care. Where we're going and where we've really grown is adding in more and more specialty care. And we're also complementing our virtual care with physical facility partners. So that's both partners for hands-on care for primary care-based needs. We'll send people to the home if you need home-based care, but then also specialists. So in-person specialist partners, whether it's PT, ortho. And we're building an entire benefit around our care model. Okay. So I would say I really see Firefly as getting outside of the virtual primary care bubble through the full benefit, and just by taking on more care and providing longitudinal ongoing care as opposed to episodic, convenience, and actually solving for value.
All right, Jonathan, talk to me more about this benefit that's being wrapped around this. I want to hear more about that. What exactly does that mean?
Well, as you know, Jessica, I probably told you this in a million of these podcasts, there's a lot of things wrong with healthcare, and one of them is that the demand curve doesn't work. If a hospital raises its price, they don't lose any market share. And if they lower their price, they don't gain any market share. And so the bloat just accumulates: extra hospital beds, extra exam rooms, extra EKG machines, just sort of absorb into the healthcare system. And so I've always just been interested in things that would kind of flush that waste out. And so what makes the demand curve work? Well, the one thing that really does work that hasn't been regulated out or subsidized out is businesses buying healthcare coverage. So if you can take all these inventions that all these cool new digital first companies that have been, we've had a renaissance of digital first companies funded in the last 5 years, very exciting, but they will just sort of be unconvincing additions to the otherwise bloated system unless they can somehow get into the demand curve. And so what I love about Firefly is they're saying, hey, we'll use all this cool virtual technology, the ability to hybridize or virtualize visits that otherwise would have been in person, to move the site of care out of the hospital into the urgent care, out of the urgent care into the ether, and we're going to turn it into a savings. So we're going to go to employers and say, hey, how'd you like to get the same coverage, maybe better coverage than you had before for your employees, better access, and have it cost 30, 40% less.
And we're going for half price. I'd say, and we're going for half price. Right now, what we're building, we're building towards half price healthcare that's twice as good clinically and emotionally.
That's our mission statement, is half price. Stop talking
Half
about
price.
all the peer reviewed and the quad aim and the triple aim. Cut that cost in half. We have an existential threat as a country, which is our healthcare costs going up irrationally, not in proportion to any satisfaction or quality of life or anything else. And this company is really targeted at using the cool technologies and the virtualization that we've learned from over the last 5 years, especially the last 1 year, and using it to turn it into demand curve value for people.
And I love when you say getting rid of the bloat, because it really goes back to this idea of us Marie Kondoing the healthcare system. We're taking away all of the waste, all of the extra, unnecessary visits, unnecessary referrals, and we're really only keeping what drives value, quality, and exceptional experience.
Darling, did that emergency room visit really sing to you?
Yeah, exactly. And we're doing that, we're unbundling. So I think of what we're doing, we're unbundling both healthcare delivery and healthcare financing, unbundling and then repackaging.
All right. I want to, okay, so wait. So the half price healthcare, this can be achieved by unbundling the healthcare delivery, going more into the virtual space. Is that really enough?
No. You got it. What I like about Firefly is that they're dragging the rest of the food chain. So virtualization has benefits other than savings. It's more convenient. The average Firefly member, let me start. The average member that has primary care sees their primary care doctor once every 19 months. The average Firefly member interacts with their Firefly care team, not a random teledoc, which is great, but not what we do. Their actual team that knows them 41 times a year. People get primary care doctors visits on their way home from work or on their way to Whole Foods, on the iPhone, pointing at them on their dashboard. And so lots and lots of little touches. That translates to something that excites me the most, which is genuine steerage. We can genuinely, permanently keep people from the ridiculous $3,000 mammogram when you can get one across the street for $200 using the same technology.
We end up becoming the first place that people turn whenever they need any sort of care, beyond just primary care. As a result, we're seeing a 52% decrease in ER admissions. We're seeing huge decrease in specialist usage. We're able to just instantly zoom in a specialist on our platform into that meeting, as opposed to needing to refer that person out to the large academic medical system, driving up cost, driving up time, inconvenience. And it really does all come down to trust, this proactive, trusting relationship between the patient and the care team. That's how we earn the right to navigate. And that's ultimately where we're driving a lot of these financial savings. But I think we're taking this a step forward, because we're not saying here's 30% savings and it's going right back to the payer or just the self-insured employer. We're actually trying to put together a package so those savings are going directly to the member and to, right now, fully insured or smaller businesses that aren't currently realizing any of those savings. So we're trying to cut them in. And they're the ones where it really matters. Healthcare costs can make a difference against their overall profitability. And currently there are not many ways for them to actually be rewarded for decisions they're making about their health.
Okay, so this sounds like, it sounds similar to the sidecar model here to me. So maybe I want to give you an opportunity here to talk a little bit about that. Is that the same thing where it's the costs really do appear in somebody's account? Or are you talking about something different here? I want to make sure that I'm understanding this payment model unbundling that you guys are doing and how it's different than what's already out there.
I'll let Fay take the core of it, but the Firefly model works without the financial layer and with the finance. Works better if we can map it. So the perfect Firefly model is currently illegal, which would be that everybody gets a health savings account, but unlimited access to Firefly is prepaid. So you get a doctor, a therapist, a specialist in 12 minutes anywhere you are for free, and then they become your personal shopper when you need a surgery or other things, right? That would be, and now what that does is that allows people to choose something that is actually inconvenient but cheaper and be rewarded. So today, the only real demand curve that's been working in the last 20 years is where convenience happens to align with cost. So urgent cares are cheaper and a lot more convenient than hospitals. People don't go to them because they're cheaper, because they don't get any of those savings. Their insurance company does, but they are more convenient. So urgent cares build out 50% excess capacity against what they need so they can sell on convenience. Same thing with the early telemed, same thing with the minute clinics, right? Ultimately, it would be better if somebody who was willing to fly to South Carolina to get their knee replaced in order to save $7,000 could keep a couple of those thousands themselves. Now, that isn't currently legal. So we are building a set of proxies, high deductible plans, plans where the consumer can choose their deductible or choose their premium. So we have employers where they are saying to their employees, hey, if you go Firefly first for everything that you need, your co-insurance, your co-contribution from your payroll is zero. We'll cover everything. If you want to go with randomly go through the provider directory and pick what you pick and do what you do, here's your deductible, and we need an extra $150 a month per person in your family that will pull from your payroll. That's the beginning of a demand curve, right? Now, the truth is, we just got our last Net Promoter Score back. Is it all right to share that, Faye?
Yeah, please.
92.
Ooh,
But that, I mean, anyway, that love and that trust,
guy who hates us,
Kondo, that is how we're able to do everything. It is that trust, it is that engagement, and they turn to us first.
Okay. And so it sounds like you're like a next gen health plan almost here. Am I right?
Absolutely.
This is a bloat-less Kaiser.
A bloat-less Kaiser. Okay, great.
I like that.
Kaiser
now
still
we're
has
talking in analogies that we can understand. All right.
Well, Kaiser did the brilliant thing of moving the financial risk into the doctor's hands.
Right.
But it's very abstracted, and they have a lot of overhead, right? So they've got these, you go into Kaiser, it looks like you're bumping into one of those closed Soviet cities from the 70s, and like, oh, it's still there in the building. It used to be a modern building, and now it's this Kaiser sort of urban desert. If Kaiser could start again, if Kaiser could start again, believe me, they would not build those buildings, right?
Right.
They would buy on the margin. And even Kaiser now has got internal policies around, let's make sure we only build for 70% of our forecasted capacity. So we're always buying on margin around the edges, right? This isn't, because we get to start from a whole cloth, we get to do that correctly and only have the capacity, the overhead, if you will, that is essential, which is the ability to respond to people and know them intimately really fast. Okay. So we have our own therapists, we have our own guides, we have our own doctors. We have this kernel that we have our own
specialists. I mean, we have specialists that are directly on our platform. We have virtual specialists, we have in-person specialists. So we really are building out that virtual first healthcare delivery system.
The next gen Kaiser of the future here. Okay.
That's it. And those specialists that are on the platform, the first wave of network that we've got is not the traditional network that says, hey, give us a 12% discount and you'll be on our list. No, we go to one cardiologist. He actually has moved to Paris because he doesn't need to be anywhere. Oh. We've said, we will beam you into all of our complex cardiology cases. You do not need to bill. You do not need to document in some bloated EMR, except Athena, which of course is non-bloated, or maybe it's also a little tired. Who knows? But all you need to do is tell us what we need to know, hit done, and you have money in your bank account.
And we're also, have virtual centers of excellence. So we have Dana-Farber. We have Dana-Farber for oncology, first and second opinion oncologists. We have Jocelyn for diabetes. So we have these endocrinologists. So, we're complementing individuals. We have in-person specialists. We have some virtual specialty partners. And then we have these virtual centers of excellence.
Okay. This is like, I see now where we've lured Andreessen into the mix because they love a good old platform play. No, they love what it is. Where this has come from.
That's exactly what it is.
Julie did not say, oh my God, organic pizza. Let's have another chain. That's not what she said.
No, Julie, you would never say that. She would never. Right. No. Oh, okay. No, it's totally on board. So are you guys, and this might be a detail I have missed, but can you clarify for me just in case I missed it? Are you in market with this now, this unbundled new next gen plan, and how's it working if you are? You're both nodding. Okay.
So we're in market. We're not live with the full plan. That goes live in Q3.
Okay.
With very first customer and then most go live. Most of their cycles are Q1. But we're live in market. So we're selling, but not live,
Right. The thing that's not yet live that we're very excited about, and hopefully all of you new age, health benefits folks that are watching Jessica's stuff will call us immediately. We can take this giant army of kind of under 500 but above 50 employee shops that are currently paying through the nose for full health insurance from a buka, right? And there's nothing they can do about it. Nothing gets better no matter how lean they get, no matter how on board their employees are. We can help them become self-insured in a pool. As long as those employees go Firefly first, we can dramatically change their spend and not at a compromise at all. In fact, with a higher, better set of health outcomes.
That's
It's
awesome.
not everybody, a Google, the fancy places that are terrified of losing an employee for compromising their benefits might not have the courage, even if it's better, to do a Firefly. But the regular American businesses that are struggling, let's take a guy who's administrating a loading dock in a shipping business in Chicago and say, hey, what if you had to walk out and say, I got good news and I got bad news. Good news is nobody's getting any money taken out of their paycheck for healthcare, and we're staying in business. Bad news is download this app. Now you're getting your healthcare through this first. The guy's a hero for doing that, right? Whereas if you're a law firm, it's like, yes, but I also want, cross-legged therapy in circles, whatever they want that we can't deliver that probably is clinically not valid.
We'll still give you a lot of therapy. A lot of behavioral health through Firefly. Which
Well,
is
that's why I
actually
included
another
cross-legged.
huge component of our model is the integrated behavioral health.
Mm-hmm.
If you look at our chronic conditions under 40, vast majority of people, it's anxiety and depression. It's anxiety, depression, it's ADD. And so we actually have a behavioral health specialist on every single care team. We have part of a psychiatrist on every single care team. So that behavioral health integrated into your core care is really distinct in our model.
No, that's excellent. Great segue there, Fay. Jonathan, you were going to say something?
No, I was going to say that's a really important grabber for us. Remember, the most important side effect from a total value perspective on what we do is that we do it well enough that they follow where we send them. And when you can offer 12-minute response time on anxiety and depression in a time when it's very hard to find a therapist that's covered by your plan, but actually we're probably at 12, Faye, let's be honest with the people here. We will be at 5 before you know it. But still, most people are at 5 months, this is 12 minutes. Like the ability to offer mental health, sleep, sex, anxiety, weight loss, those are things that people are actually thinking about all day. They don't cost a lot of money, but that's where you can earn someone's trust. If you do right by them on these things that are actually distracting them during the day, now when you break your leg skiing or when you develop that tumor or whatever, we really are on the other side of your red phone. It's not like, let me call HR and find the nearest navigator service.
And I would say complement that with real serious chronic conditions. So the most common chronic conditions for us, it's hypertension, it's diabetes, and our results are really off the charts. We're seeing 80% improvement with people with their diabetes under control. We're seeing over 82% with people hypertension. With their blood pressure readings under control. It's almost twice as much as the national average if you look at other commercial plans. Same with obesity. We're seeing more than 50% of our patients with obesity have lost more than 5% of their body weight after 6 months with Firefly.
That's awesome.
So we're really driving, exceptional chronic condition outcomes, keeping people out of the hospital, and they're loving their experience.
Hey, on some of those services, are you guys contracting some of that stuff out? Like, are you pulling in some of the digital health companies that are offering those types of?
So for everything I mentioned, we're not. So we're doing all, well, I should say that we're not, except we do have, for Jocelyn, for example, we do have endocrinologists for complex case management, and that's really doctor-to-doctor consults. So if there's a really complex case, we might engage them. We just signed that partnership. We had those results pre-Jocelyn, so I'm really excited to see how they improve. but we're doing all of the diabetes, hypertension, obesity, anxiety, depression, huge range of behavioral health, all in-house.
Okay.
But it's worth pointing out to Jessica's thread. I think
we are building out a network of other providers, and increasingly that's where we're investing a lot of our efforts is, adding to that virtual specialist network. So who is our virtual cardiology partner? Who is our virtual GI partner? And complementing them and bringing them onto our platform. So part of what we're doing today is actually bringing these other, both I would say in-person traditional specialists, as well as some of these other virtual care companies directly onto our platform. Our platform is something called Lucian, operating system for all of our clinicians, our patients, our referral partners, and actually having them use and operate on that.
Okay.
And because we own the whole benefit, we don't need to do the traditional referral and then they work up a claim and they send it to the TPA. We can replace a specialist with an app, to your point, or one of these digital health new startups more easily and stitch it into the spending stream much more easily than a traditional at-risk medical group can do. And to Faye's point, we have a tech stack that can actually ingest that messaging in a way that, a nice doctor on a nice EMR can't do.
Okay. Let's go back to the funding real quick because I want to talk about what the money is used for. So Faye, you alluded to scaling up and geographic expansion. So right now, my understanding of you guys is New England. So tell me what's happening next and how we're spending this money to take over the world.
Absolutely. So we launched in Massachusetts. That's where the majority of our members still are from. We're live in Maine, New York, and New Jersey. We'll continue to scale throughout those states. We're moving to 4 additional states in the coming quarters. So we'll be in Connecticut, Florida, Texas, Ohio, possibly North Carolina. And I would say more importantly, we are building out this full benefit. So the vast majority of the funding is going towards the new product, meaning the full benefit development and the geo expansion.
Okay.
We want to be national, obviously. I mean, whenever we sell an employer and they have people that aren't in our licensed service area, we have to let them out of the Firefly, experience and let them go old school, which is a bummer for them and us. So our goal is to basically
have a national network that, so that we can still service people that are anywhere, but we don't have our own curated network in all states.
Okay.
And that's what we're getting towards. And we're looking forward to hiring, exceptional people to help us get there too with this round.
Awesome.
Point out, since I'm sure there are many DeMassa fans watching that are in charge of network development, and they've got to have, 2 dermatologists in Toledo and 2, oncologists in Nebraska. And, our network development challenge is much smaller because we have these virtual specialists. We can have one cardiologist nationwide. So even if we have only 100,000 or 500,000 members, we can have more density, more control of calendar, and more supply chain partnership with our specialists than even United, with hundreds of billions of dollars of revenue, but actually, no doctors with more than 15% or so of their dance card as United members. So there's a very, very cool shortcut to building influence with specialists and partnership with specialists that comes when you can eliminate state and city lines as a requirement for network development.
I got to hear about this for a second because you brought up United. Is that who you view as your top competitor? Are you guys worried about Amazon Care? Are you worried about the Amwell United partners? Like, who's your top competitor? Who are you competing against?
I think we're good.
Go ahead.
You can fight over who gets to answer this first. We'll hear from you.
I actually think it's much more about inertia. It's what people are using today than anything else. I'm not as worried about all of these other upstarts so much as, whether it's traditional BUCAs, traditional primary care. I think that is the real competitor. It's inertia.
All right. If anybody was going to throw a name out there and poke a bear, go for it.
No, I used United as the example because they're so big, right? You can't get bigger than United and still they don't have a lot of power over their specialists. That was the only point, right? I agree with Faye that the real competitor for us is kind of
status quo
or fear of change. You don't want to, you got to be a tough guy to go tell 100 employees, hey, we got to save money. You got to change the way you do your healthcare. Healthcare is very personal. The idea that it's covered by your employer is an accident of post-World War II anti-inflation policy. Like, it's not it's weird shit that the employer gets to get into something so personal as your health. So we really, in order to get this to be safe and normal and better, we know it's better objectively on the numbers, but in order to get it adopted, we need to find those folks that are ready to leave old-fashioned Blue Cross, for which they just cannot afford, and try this new thing. And I agree that that's the challenge. Not the more direct primary care, digital, sexy, buy billboard people out there, the better we do. It's like having a second Starbucks in the neighborhood. Everyone has more espresso.
Okay. All right. I want to talk current events with you guys for just a second. We'll wrap this up right after this. But so Jonathan, I'm going to start with you. As OG health tech, the money flowing into this space, not even just in virtual primary care or primary care, but just in general. I mean, like last year, it was like, something like 22 billion or 14 billion, depending on, which funding report you read. What do you think of all this money coming into this space? I mean, is this bringing back memories of the early EMRs?
Yeah.
Or is this a whole different animal now? I gotta ask.
You gotta remember, we met when I was trying to start a program called More Disruption, Please.
I remember that.
And we were trying to promote entrepreneurs, engineers coming into this boring regulated space of healthcare. And the year we started MDP was 2014, and that year, total VC into this digital health space, total nationwide, was $896 million total, according to VentureWire. Okay, that's enough to run the HHS parking garage for a day. It's just a non-number inside of this. So at one level, obviously, I find it incredibly gratifying and inspiring, and it really makes me believe that we will actually see, for the first time since 97, a bend in the cost curve of medicine. If it doesn't get regulated out of existence, there will be a bend in the cost curve of medicine and a dramatic improvement in people's experience of it in the next 15 years. The other thing it shows me is Jerome Powell's full of shit, and we got inflation coming out our ass. I mean, there's no way that part of this isn't the fact that people can go replace half their equity position with free debt subsidized by the federal government. That makes more dollars go into equity, which makes the price of a share of equity go up, which means if you're thinking about VC, don't go invent a company. Eventually that'll work itself out because everything will have inflation, a real inflation in the rest of the economy, and we'll be back to normal again. But there's no question in my mind that part of this is not that the people who are getting these valuations are amazing, except for Glenn Tolman. He is amazing. $18 billion. Holy shit. For $200 million in revenue. Holy shit. I mean, holy shit. But in general, I
you gotta
think
go outdo him now, Jonathan. I mean, you and Faye, you gotta take that on. The gauntlet has been thrown here. So, I mean, you guys are gonna have to, when you IPO Firefly, I mean, we gotta see here.
Absolutely gonna outdo Glenn Tolman. That was my whole reason for being in healthcare again. And then he just crushed it. There's no chance. Nobody can win against Glenn. It's not even worth playing anymore. No, that was a wonderful creation, and he did a great job. But I think, of course, we're seeing some inflation, obviously. But there's nothing to do about inflation except for make sure you own a lot of equity so you can ride the prices up. And so I think I also think that inflation is a really good place to play if you're a saver, if you're a cost savings play, because as prices go up and up and up, it's easier to come in under. And so I think that'll lend itself to Firefly's new packaging strategy, product strategy, quite nicely.
All right, Faye, close this out for us. What do you think about about this particular space, about virtual primary care and maybe primary care moving forward? I mean, the amount of money that's been thrown into this. I mean, pick an area, right? I mean, the $1 billion Walgreens Village MD deal. You could talk about crossovers, 168 million from a few weeks ago. I mean, pick a spot. There's just money flying everywhere. Do you think that this is going to continue to be an area of healthcare that's invested in moving forward throughout 21, 22? Or do you think that bubble is going to burst a little bit sooner than some might think?
I think it will evolve. I think that, thank goodness all this money is being poured here, because there's a recognition that things need to change and that this is a huge lever of value and people want it. So I think it's an incredible sign of demand. But I think that I hope that, as Firefly has evolved from, this narrow definition of virtual primary care, I think that the money will also evolve beyond just primary care. They'll recognize, actually, what about the specialty care? what about the natural, what about the benefit? And I think that the virtual primary care will become a foundation for a lot of other investments.
All right.
Yeah. I think, Fay, you're the one who I think told me, like, hearing people talk about another telemedicine company is like back when people talked about telebanking. It's just a tool. What we need is better banking.
Yeah, exactly.
Better banking.
Exactly.
Banking with less fees, that's more accessible, and it's not a pain in the ass. That, that's what medicine should be.
This pandemic has made everybody a telehealth company. It's also made almost everybody a mental health company. It's very interesting.
And I hope that next year we're not talking about virtual primary care. We're talking about primary care, and then forget about primary care. We're just talking about great care.
Yeah.
But it's really just about great care, regardless of where it's delivered, whether it's virtual, whether it's at your home, whether it's at an urgent care. It's about, the continuum of care.
The sexiest part of this whole thing, you guys, I love that you're taking on the benefit. I love to see some payment model innovation. So congratulations on that. You guys, and also congratulations on the Series B, the 40 million that you guys raised. Andreessen bringing Julie Yu to the board. This is big news, you guys. Thank you so much for stopping by to talk to us about it. Fay Rotenberg, the president and CEO of Firefly. Jonathan Bush, executive chairman of Firefly. It's so great to have you guys with us, and I love the dynamic between the two of you. It was like such a fun interview. Thank you guys so much.
Thanks, Jessica.
Take care, Jessica. We loved it.
All right, awesome. We'll talk to you guys soon. Pop back and give us an update whenever you can. I'm Jessica DeMassa. This is What's the Future Health. To find more interviews with those who are changing the way we do healthcare, please visit my YouTube channel over at youtube.com/WTF Health. We'll talk to you guys soon. Thanks so much for joining us. Bye.